Gleason. I guess I'm the B team when it comes to filling in for John that normally is in the seat here. And so I'm joined by some amazing panelists today, and we'll allow these individuals to introduce themselves. And so I'll let you kind of popcorn it off one another and go around the room.
Okay. Oh, go ahead.
My name is Liam Hine. I'm on faculty at the University of South Carolina in the College of Nursing. Obviously, I'm a nurse, and my focus, of course, is LGBTQ health, and I identify as a trans man myself. Celeste?
Hey, I'm Dr. Celeste Nagy. I'm a facial plastic surgeon, double board certified in both otolaryngology and facial plastics. So I do gender affirmation surgery for facial feminization and facial masculinization, as well as doing chondrolaryngoplasties or tracheal cartilage shaves for patients that want to change their appearance to affirm their gender more.
And I'm Dr. Julius Johnson Weaver. My pronouns are he, they. I am a Black transgender non-binary man. I'm a board certified family physician that owns my own practice called Resolve MD in Columbia, Maryland. And I run a gender affirming care program as well. Yes.
Thank you so much for everyone introducing themselves. I'm Tori Gleason. I'm located in the state of Kansas. I'm a clinical analyst at a local health system here, a community hospital. And I am going to, I guess, give a little infomercial, I guess, on some of the things. It is giving season. I want to make sure you support OutCare's mission for Giving Tuesday coming up November 28th. And then you could visit outcarehealth.org at /donate. And hopefully Chris will throw some links in here for us. As we'll get going with that. Also, we are looking for people to join our board, and serving the last 2 years has been a tremendous honor for me. And I would highly recommend for those of you that want to get involved in a national organization that really works with a lot of organizations, a lot of insurance companies, et cetera, just working on collaboration, education, working on access and barriers. This is a group that I highly recommend, and December 1st is that deadline. So let's make sure we get those applications coming in so we can add to the skill sets on our board. And we'll get that link in there as well. We also know that this is Transgender Awareness Week here, the 13th to the 19th. And so want to make sure that we don't miss that conversation as well. And so with that, and then as well as the Day of Remembrance coming up on the 20th. And so making sure that I get the infomercial out of the way before we get into having some conversation. And that's really what today is about, is that we have some brilliant people around on our panel, and I want to make sure that we get everyone on there. And thank you for posting those links in the chat. And please do join. We have a tremendously talented educational group and different subgroups and subcommittees that does some excellent work in education and really creating just opportunity for conversation, for education, for talent and CMEs. With that, I started off with, gender affirmation is something we hear a lot about. And with US Path being last week and just wrapping up, and I know we have, you're hearing gender affirmation talked about a lot with even the American Public Health Association annual meeting going on right now. And so what I'd like to do is say, what is gender affirmation to you in terms of how you work with your clients, and just sum that up real quick for the people watching to understand what that really means, because some people get tripped up by that.
I'm happy to start. So for me, since I'm a facial plastic surgeon, I usually am seeing patients when they've already started their journey as far as transitioning. In general, a lot of patients have already seen primary care, mental health advocates. Maybe in general, I do like patients that have already started on hormone therapy if they are transitioning, because surgery is obviously a permanent change. So I want them to be fully committed and have really worked out this decision before I want to take any action. But with that being said, it's such a spectrum as far as gender affirmation that I want the patient to feel comfortable in their own skin. So that's what it means to me. In general, I am doing either facial feminization or masculinization. What that means is basically changing their facial features to still reflect who they are, but create a more something that they identify with more, as physically seeing themselves of what they feel internally. So that's a completely individualized, tailored approach for each patient, and also setting realistic goals as to what I can obtain and what I can do. But with that being said, I often have patients that are non-binary, or only one thing bothers them. They don't want to change a different aspect of their face, or just this very broad chin, or this very prominent brow bone, or whatever it may be. And some want to do a more complete change. But either way, it's all about really communicating with the patient, understanding their journey, how long they've been on it, understanding their support system. Surgery is never anything that I want a patient to go into lightly, or expected to change who they are, or if there's a different issue that they're battling, thinking surgery is going to change that. So for me, gender affirmation in particular is patients that have already started on this journey. They already have a sense of who they are, and I'm just there to be another stepping stone in the process. So not only do they see themselves reflected in the mirror of who they feel they are, but also that they're getting that externally. For example, some of my patients tell me how much it means to them to be correctly gendered when they are seated at a table at a restaurant, and not misgendered. Or, a flight attendant speaks to them and says ma'am instead of sir. And so for me, that's my goal, is to make them feel comfortable in their own skin, and not project what my ideal is on them, but what they want to reflect to both themselves and to the external community.
I can sort of piggyback off of what Dr. Nagy said. This idea of making sure we ask patients what they want. As everyone knows, a transgender and a gender diverse person all can have a very diverse set of goals in terms of what their gender identity means to them and how they want to express that identity. And so I typically in sort of my own world ask them sort of, what are your goals? What's going to give you that sort of gender euphoria? What's going to make you feel like you belong and that your gender identity is connected? And that's a great place to start. And often we then sort of move socially, sort of what we can do in a way that doesn't necessarily mean medication right away, but in ways that can be helpful, especially when we're talking about youth. It could be as simple as sort of dressing differently, or using their chosen name, and sort of getting their parents on board to use their chosen name. So we typically start with sort of social. Is the school affirming to them? Do they have a job? Is their job affirming? So in what areas are they feeling affirmed? And again, it typically is pronouns, use of correct pronouns, use of correct chosen name. And then we can, over time, especially with adults, we're talking about hormones and what are their goals with the use of hormones. And that really varies, and it's really great, especially now as we are sort of seeing more folks come forward as non-binary. And I think that's just because the language is there. Certainly we've existed for a very long time, but as we see that, then it's not very cut and dry, sort of the stereotypical sort of binary view of sort of what a man is and what a woman is, but sort of where in that sort of spectrum are you? And so, yes, so socially, medically with hormones, and then, in the primary care setting, we're talking about referrals when we want to do anything surgically.
I appreciate that. And I love that individual attention, as well as that goals and what gives you gender euphoria, and that kind of that trans joy that we are starting to see a lot in literature as well. Professor, do you have any comments you'd like to add to that gender affirmation, or do you want to, and let me pivot that to what does that space look like where you take care of patients? And is it important to create a space that's welcoming and affirming for your patients, your clients, and to experience that as you treat them?
I personally think it's super important. Right now, I'm not in clinical practice, but I'm teaching students and interacting with, actually, we have several thousand in our college right now. And to me, is being that open person, being someone they feel safe with. I can show that through simple symbols on my office door and in my bio sketch, which is up, on our university website. I regularly get students from other departments that I have no interaction with track me down to come and talk to me. And that to me is some of the most fun I have, is actually being that safe person in a somewhat tenuous state that they feel they can come to and even do research with, and ideas they might have. I have a lot of fun with that.
I think that's great that you create that safe space. And for me, in a primary care setting, it's similar. People need to see themselves, and they need to know very quickly that a space is safe. Going to see a doctor is a very vulnerable place to be. And so symbols are wonderful. I like to make sure there's imagery present. So right now, people sort of meet you online first, looking at websites or social media pages, and making sure that the photos that I pick up are very diverse. They're going to show queer people. They're going to show trans people. They're going to be racially diverse, and so that's very important. And then the language, that is a big one too. Making sure on either my website, again, my social media posts, I'm using either gender neutral language or very expansive language. And so I think those are two very big sort of beginners that kind of tell people, hey, this is an inclusive, welcoming space that I would be entering.
And in creating that culture of belonging is really important. And Dr. Nagy, do you have any what do you see as strategies for other people, other colleagues around yours, and your team members, creating that, again, that culture of belonging, that space that's safe for your patient population? What does that look like?
That's a great question, Tori, because a lot of I had to do a lot of training for my staff, actually, because I joined someone who is been in practice for many, many years, and he himself had never didn't offer these services that I'm offering. So the staff hadn't been accustomed to not necessarily not having queer patients, but in particular transitioning patients. And so we had to do a lot of training with the staff in order to make sure that they were properly gendering people. We changed the intake forms, for example, to say what was your birth gender, what is your what gender do you identify as, what is your name that you choose. A big reason too being because, of course, if you're going into surgery, we really need to know all that information. So for example, like I had a trans patient who we, of course, while she was in the office, use her given name, go by her pronouns, all of that. But when she came to surgery, didn't tell the anesthesiologist that she was trans, which I guess I'm happy that she's passing so well, but at the same time, didn't divulge that information. She did take a pregnancy test, which obviously she doesn't need to take. And then during the surgery, they're like very confused about her blood pressure and all these things. And I had to explain that she was trans. And so it's one of those conversations with patients that we do have to have where we want you to feel comfortable in our office. And I'm very happy that my staff has been trained to always use their pronouns, use their given name, make them feel comfortable. And that's the feedback I've gotten continually, both with my trans patients, but also their family members, or whoever is their support system, about how welcome they feel, how comfortable they feel. But like I said, from a surgery perspective, we do have to explain to them that we're glad that you feel safe here, but you also need to feel safe giving your entire medical history. And we're going to have to divulge that information. So though you are, well respected within our office and within our community, your entire history is important to us. And so it's important to develop those connections, like you're saying, Dr. Johnson Weaver, about making sure that they feel comfortable, divulging that information to you, and that they feel safe, and that you're honest with them about what you're going to use that for.
And I guess to continue that, which I think is really important, and it's a constant work, right? Even in our small local 2,000 FTE hospital, it's that constant, we move in inches, not miles, as we try to work on training, and we see where we fall short in that education as we hear stories from our patients. And and you would think, even me having a seat at the table, as we all do, that we'd be able to head it off of the past and correct some of the harm that happens in healthcare. And a lot of harm does happen in healthcare. And with that, I guess I want to speak to a topic that's really important to me, is intersectional identities, and how that presents in your office, and your experience with working with patients, and what that looks like from gender affirmation. And I'll let you kind of take that the direction you want to, because that's an important part of holistic whole person care for trans and non-binary individuals.
Sorry, were you aiming that at me?
Anybody that feels comfortable answering
Oh.
that, I just want everyone to come to the table and have a conversation. So,
well, for me, like I said, it always starts with a conversation. I always leave an open-ended question of, tell me a little bit about both you and how you identify. And so that way I get a better understanding of what they're looking for. Obviously, I'm kind of more at the tail end of a lot of their journey affirmation or gender affirmations, because they've already done a lot of preliminary work with starting that path. But for me, like I said, it's an individualized approach. I do have patients that are non-binary, and like I said, a lot of times we'll do non-surgical procedures to kind of start, in order to make sure that they feel comfortable with that, and really just about what it is for them that they want to accomplish. But either way, there's people that present different ways every time they come in the office, and it's all about just accepting who they are and making sure that they're choosing to do things because it makes them feel better, not because they think it will solve any other issues that they're having. And I think that's just always, for me, is open communication, really connecting with the patient and making sure, like we talked about earlier, that they feel safe, comfortable, and that it's an unjudgmental space.
I think this is a big part of my care as a primary care physician who is a minority racially. And actually having lived, I'm a late blooming transgender person, so actually having lived many decades, as a woman. And so when I look at the intersection of my own identities, having been socialized as a woman, so meeting sexism, being Black, so meeting racism, and then now we're adding this identity of being transgender. I think I've always worked from a lens of advocacy and social justice because of my own intersectional identities. And that's sort of what you get in my office, sort of this willing to understand how those identities are going to impact your care. The transgender and gender diverse community is very, very diverse. And so if you have someone on one level of one economic level, or again, as I said, a person of color, what are the barriers that are they going to face? And we know when you hold multiple marginalized identities, it is harder to access healthcare. It's harder to access, doctors where you may be able to get into to get gender affirming care easily or not. So really looking at that whole person and understanding that may make them also not feel as confident in themselves, advocating for themselves, what's going to be the cost barriers. When you have racial identities, is there a strong religious background that's going to sort of mean that their parents or their family around them aren't going to support them? So kind of looking, just as Dr. Nagy is saying, you're kind of trying to get all of the information, not make too many assumptions, but really understand that all of these identities together can honestly cause some obstacles to care, and you have to sort of be aware of them.
I appreciate that. Number one, your lived experience, and then what you observe in your direct patient care, and to talk to some of the barriers that individuals face from a systemic perspective or from social aspects in the community that they may have with different identities that they live in, special multiple identities, and that intersectionality that comes with that. And I guess what networks, what resources do you think it's important for us to give to our patients, to give to our clients, to be able to make sure that we can, remove barriers to get them to be successful in terms of their holistic journey, their aspects of gender affirming care? Where do you see that as in your own practices?
I often get asked the question of what's available in my area by students or even new faculty to the university. And it's very helpful to be able to refer them to the local community center, to refer them to things like the out list as to where they can get care when they're new to the area. I also was actually, like Dr. Johnson, I came out quite late as well. So with many decades, in my case, as a lesbian, and before I transitioned. And what was really helpful to me actually came from a more experienced trans guy. And believe it or not, I know it's not super, cool anymore, but Facebook or Meta actually has groups that are, you've kind of got to be vetted. And it was for a trans guys over 40 group, because there are going to be different issues, based on if you're in your 20s or your teens or even your 50s, whatever the case would be. And so that it was super helpful to me to be able to see, people are just talking about their own experiences. Is this normal? Is this normal? And guys just jumping in and saying, yep, happened to me. Kind of sucks. You're going to go bald, but live with it. And, enjoy not wearing a shirt. Baldness, no shirt. It's worth it. So those type of things that can be super fun and helpful.
For me, I have enjoyed connecting with other medical practices in the community. Like we have a clinic called Queer Med. I did my residency training at Emory, and we have a transgender clinic there. So I've connected with a lot of them, as well as voice therapists, because I for transgender patients that want to actually change their voices. So for me, it was developing a referral, not only a referral system, but a network for these patients. So for anything that I don't do, especially with hormone therapies, things like that, I want to make sure that I know someone who's very good at what they do in order to refer these patients to them. And mental health advocates, all of the above, that have training in gender affirmation issues. So for me, it's developing those connections with other healthcare providers that I know are trustworthy, I know are safe, I know are going to give the best care to these patients. And then, the other aspect for me is actually making sure that they have social support. With anyone that I do surgery on, I want to make sure they've got someone to help them recover. So it's really great when a patient comes in with a partner, or a friend, or someone that can really help them, bring them to their appointments, pick up their medications, whatever it may be. So that's another question I always ask them. And if they don't have someone, then a lot of times we'll try to help make sure that they've got some sort of nursing care, or, in order to help them with this aftercare. So it's not only making sure that they have care from a medical standpoint, it's also making sure that they have care from a social standpoint, and that they have enough support to go on this leg of their journey.
Thank you. And one of the things I did want to pivot to in the Q&A section, there was a question posted, Matthew. Thank you. Do you experience, excuse me, difficulty coordinating care with HMO plans that aren't caught up with WPATH support letter guidelines for gender affirming surgery authorizations, which is a fantastic question.
Well, I practice in Atlanta, Georgia, so absolutely in fact, they recently passed a law about not allowing minors to have any sort of transgender medical care until they're 18. So it's kind of a constant battle. I'll be honest with you, I'm in private practice and I just don't take insurance for this reason. So what I do as because it's so unclear and it completely depends on the patient's insurance and all this stuff versus somewhere like New York or California. So what we do for the patients is we help them to file a claim, and help them with pre-authorization. So though they have to pay for their surgery in advance to me, I do operate sometimes at a hospital so that if their insurance does cover it, they can get their OR and anesthesia fees covered. And then we help them file a claim on the back end to get their surgical fees covered. But unfortunately, because it is so up in the air in the state that I live in, I just can't, being in private practice, kind of constantly be fighting those battles. But we do as much as we can to get coverage for the patients. But yeah, it's hard because it's totally state dependent. It's totally your employer dependent. There's some companies that cover it completely that are mostly based on the West Coast or New York. And they can come to my state to get surgery, but it's a whole, that's a hassle too. So unfortunately, until there's, I think, a nationalized system, if there ever will be, then it's very individually dependent. So we just do the best we can with working within a hospital system that will cover a certain portion and then helping them get reimbursed on the back end.
I personally experienced within the last month, my primary care doc who prescribes my hormones, their office accidentally sent it off to one of the mail order where, like high blood pressure stuff, sent off my testosterone prescription there. I get a letter in the mail saying they are denying it because my insurance doesn't cover it. Been on this for years. Doesn't cover it because of being transgender, which is absolutely not true. What it turns out after investigating through Walgreens and other places who will fill this with insurance, is that it's somebody based in Missouri with this mail order pharmacy, I'm not going to say by name, who decided they wanted control over a trans person whose script for hormones came in. And so it's the luck of the draw as you're talking about, interacting with different aspects of the system. If I wasn't in healthcare and didn't understand how this could be played in ways around it, it would have been very, very discouraging. As it is, it's pretty annoying that I'm being played with.
Often the bigger centers that are offering gender affirming care will have trans navigators. So there's like a whole position in addition to the insurance folks who are really trying to help work through this. And that is, it's nice that there is that position, but it just goes to show you how cumbersome it is in terms of sort of coordinating care and getting coverage. I did want to just add a few more things to the support. If you have sort of newer out people in the queer or trans community, I want to second Facebook. I know it is older, but there really are a ton of groups on there that are based, with you can sort of even put in, again, like age or if you're non-binary, And I think that that is really wonderful to kind of have that forum. And then your local PFLAG and their support groups. So some people rather not be virtual, but to be able to go in person, I think is wonderful. And you want to find your local LGBTQIA plus center, and they will typically have a support group in person too. And lastly, one of the things that was really wonderful for me as I've been transitioning is Instagram and being able to just follow trans people. Just looking at, we talk about trans joy, but just looking at people thriving, and that has been so joyous to just not think of like, okay, I need this support, this therapy, I need medicine. It's just kind of watching trans people moving in their sort of normal lives, doing normal things. And so that's been very impactful. And when you start to see yourself, then you start to dream more as to sort of what can be possible.
I like TikTok for that same reason. It is nice seeing people just being themselves and comfortable in their own skin and having fun with it.
Absolutely.
And I appreciate that conversation around that, and again, title of the webinar is Gender Affirming Care, but part of that is the non-medicalized aspects of just trans joy, right? Like that, and all of you have spoken to that and what that actually looks like. And part of that is that aside from the healthcare piece, aside from medicine, what do you see your patients? How do you see the responses? And I guess I really want to get to the heart of what that looks like in your patients as they feel that gender euphoria, that trans joy. And I really want to, I guess if you feel comfortable, please speak to that. Maybe it's on your own part and what you've experienced in yourself. I know I can speak to it, but I'd love to hear from you in that aspect of what you see from an observer standpoint in the population.
For my own case, it was being in the backyard without a shirt on for the first time with a breeze. I've got a fenced yard, so nobody could see me anyways, but still, it was like a huge deal to me. And I was in a meeting with some folks shortly afterward, and I'm like, ladies, if you have never been outside in your fenced yard without your shirt on, you got to try it. It was just awesome to me.
There's so many moments, and that is definitely a big one as well. Sort of the shirtless one is like, any chance I get, I almost wish I was in warmer weather all the time because I just rarely have a shirt on. It's like being like a teen boy all over again. Like, it's just like, it's wonderful. Certain clothes for me as I was transitioning, which actually helped me learn who I was, I would put on a certain shirt. I was definitely a masked cis woman. I thought I was a masked cis woman for many years. And so wearing sort of ties and shirts, but then I started to realize it was much more than that. But anything that would just sort of really make me feel like what I felt inside, it's almost indescribable, like to see yourself through in a mirror, the way you've always sort of felt inside, so that is a big one for me. And then thinking about patients, I tell people often, I get as much out of caring for transgender and gender diverse patients as they get out of coming to my office. It is watching their body, their posture, their look as you affirm them. Sometimes maybe saying their chosen out loud for the first time, having an authority figure say that, or talking to them with their parent right there and using their pronouns. So you're modeling something for their parent to be able to do when they get home. I walk out of first visits usually almost tearful because it's just so special.
I can't say that I've had a personal experience, of course, but like I said, I feel really amazing when my patients are recovered and they feel like they finally look like themselves, like they feel like they are finally seeing themselves for the first time. And I particularly remember I fortunately was able to operate on a patient before she went to college, before the law was passed in Georgia, because she wanted to transition between her, or she was already in the process of transitioning medically and socially, but wanted to have her surgery before she went to college so she could identify herself as a woman. And she told me about the time she went to orientation, and they got seated at dinner, and it was the first time that they called her and her mother ma'am. And that was really, really special to her. And that she was going to feel comfortable going to college now that other people saw her the way she saw herself. And so for me, those are pretty touching stories, because of course like I said, I'm really seeing patients kind of after they've already started their journey for a while. So and what I do in general is to make patients feel more confident in themselves. At least that's always my goal. So having those patients that are undergoing gender affirming care or surgery with me or procedures is what I'm ultimately trying to achieve. And it feels very rewarding to have that, and for our patients to feel confident going out in the world publicly and being able to express themselves.
Thank you. And you said it, Doc, and the point you made earlier of and I guess Judy actually pointed it out there, when it comes to dream more. And so I appreciate that you mentioned that, Doc. And one of the things that I wanted to get to the behavioral health aspect of things is supportive conversations on, are you aware of approaches on how you get families to, when a family may not be very supportive initially, how might that look, and suggestions you have, recommendations you have as that family unit moves together and they try and figure out where they're at in the world and go from there. I know I'm overgeneralizing, but just having a conversation to make it more broad, depending on your level of practice and teaching. And you'll see that question over in the chat.
What I find is helpful is to involve the family as much as possible. So if you can bring them in on visits, and again, sort of modeling the language and asking questions to the patient to get that individualized approach, it really does start to open parents' minds to what's going on. And again, you're also affirming who they are, and you're an authority figure. And sort of that gets to beat against the transphobic rhetoric that we're hearing all of the time. And so I found that to be the most powerful. And then the next one, I'll keep parents in the loop often. So I may even, like, I just sent a parent I think it was like a parents of transgender, it was a day celebrating parents of transgender children. And it was a neat ad. And so I sent it to one parent, just kind of like affirming them in their process as well. And I'll also give them some support groups to go to, because there's definitely often a grief that's occurring. But I just try to remind them that grief you should not be showing in front of your child. Or, if you're a partner, you really don't want to grieve with them. You want to do that. That's work you need to do on your own, because you need to be the supportive sort of rock for that person who's transitioning. So looping them in, giving them support groups, and even telling them, hey, you may want to consider therapy for yourself, are all kind of helpful ways.
And I appreciate your approach to getting that collaboration and that the resources that are available, and actually making sure that we're looping parents in and sharing resources as you see them, which is really important as well. I know actually my physician's actually on this call right now, and so I can tell you that she's an amazing human being, and the connectivity, the support and resources she has, where she continues to learn, she continues to dig in, to go to conferences, to teach. And I think it's really important that we're forever learners, and we're doing the best we have. And with that, I guess I want to get a sense for, where we are in our learning journey, and as we learn about ourselves, and whether we're in the community or we take care of the community, or both, and just continue to connect with. And I just want to, out of curiosity, here at 15 till the top of the hour here, community advisory boards, listening to those people in your community. Do you have those set up in your practices, in your organizations, whether that be School of Medicine? And I want to hear your suggestions on that, as I hear that's a best practice approach for many hospital health systems and private clinics.
I wouldn't say that, well, yes, we actually do have, we have a university LGBTQ faculty and staff caucus. So actually, our leadership does consult with us on some of their policies. Now, of course, as a state university, we have limitations as to what they can enact, but actually, they do come to us about some of that.
I mean, I'm in private practice. I'm not part of a large hospital or organization, not anymore. And but I make sure I'm involved in the community because I want to know what's going on. So there are sort of commissions that run just basically in the county that I'm in. I've joined a community advisory board for a nearby hospital that deals with trans and gender diverse folks as well as sort of the risk for HIV. So I think one, you mentioned sort of lifelong learners. Yes, constantly going to conferences and sort of making sure your knowledge is up to date and networking, but also having your sort of ear to the ground, so to speak, in these community advisory boards or commissions. So you kind of know what people are saying and what is needed.
As in private practice as well, you know, I don't have like a board or anything. I get to make my own rules, which is nice. But at the same time, like I said, since I trained at Emory, I am connected to them, which is I guess the biggest academic center in Atlanta, Georgia, and pretty much the entire state. So and they do have trans advocates. They do have a trans clinic. And they do have plastic surgeons there that do body work, which I know all of them as well. So though I'm outside of it, I still stay connected to them from a medical standpoint and from a community standpoint. And then, like I said, taking the task to get to know other people in this medical field and mental health field within the larger city so that you do have resources for those patients. But it is always challenging when families don't support the patient. So I think it's important to both find resources online through social groups like Facebook and TikTok and Instagram, as well as in-person groups, because of course we want them to feel comfortable in social situations and find other people like them. And so making sure that they have that support and that they're feel safe and feel comfortable and that we can make those referrals is important.
I appreciate that. Thank you. And if there are other questions from those in attendance today, please don't be afraid to send those questions in, as I know that we're coming up on about 10 minutes before we finish up because we want to be respectful of time for the panelists as well as the attendees. And one of the things I wanted to ask, to get into that, dream more, dream bigger is what is your hope or vision for the future? And I know that's something John and all of the others have always kind of asked and put out there, but I'd love to hear that. So again, that question was, what is your hope or vision for the future? And I would love to hear that from each one of you.
I recently went to, and so this is on a personal level, I recently went to used a male locker room for the first time. And I've gone to men's bathrooms, that's not a problem. But a locker room where you're, changing, showering, that kind of thing, was at a spa, was the first time. And there was a lot of, euphoria as I was able to do it. And I was walking through and thinking, I'm passing, I'm okay, I'm safe, right? So this is what I'm saying to myself. And it dawned on me that I was happy that I was there. I was euphoric that I was able to use it, but I also had to pass to use it, right? To feel safe. And so my hope for the future is actually a little complex in the sense that I kind of hope trans folks don't have to pass. I'm a proud trans person, and I want to feel safe as a trans person using the locker rooms, the bathrooms that align with my gender identity. I don't want to dismiss that part of me. And so that is actually my strong hope for the future.
I love that.
Yeah.
That is awesome. Wow.
Yeah.
I'd
That
like
was
to hear what you think, Tori. What
You know,
is
go
for
ahead.
you?
For me, oh, thank you.
Yes. I'd like to
You
hear
know, for
from
me, it's this ability to collaborate and have conversations, and these aren't easy conversations. And you know, oftentimes, whether you're in South Carolina or Georgia or Kansas, in my case, right, you often feel like you're in an island, and you feel separated. And there's always, you know, there's sometimes it doesn't feel like you have a sense of community, a sense of belonging, right? And so I think with that, my hope for the future is more of a sense of belonging, that connectivity that comes with personal relationships with amazing human beings. I know I before the call, I called you my nerd herd, right? Affectionately. And it's having that ability to have dialogue and to learn from. And I think that that's my hope is more sense of community and more sense of sharing of knowledge and resources and best practices. And you know, watch out for this because this doesn't always end up well. And let me teach you that mentorship. And I think that that's my hope for the future.
my hope for the future is a little bit, I'm not, you know, you said it so beautifully, Dr. Johnson Weaver, but I'm, you know, a cisgendered white woman. I've never had the fear that you guys are talking about of going into a space, and and you know, and that is something that I can't personally relate to. But one thing that I hope for the future is that people stop um politicizing this as a movement, or it's a political thing. It's a personal decision, and it not only in gender affirming care, but in a lot of decisions for women and healthcare in general. I just don't understand why politicians are making choices for people instead of patients and doctors and nurses making those decisions for themselves. So for me, my hope for the future is that this is not something outstanding. It's just normal. You are who you are, you're who you identify as, and people stop caring and judging you and trying to put parameters on you. But you get to make the decision as a well-educated, consenting adult to do what you want to do with your life. And I think for me, it's as someone who's an ally to the community, but not personally experienced it. That's my goal, is to be able to treat patients without having to worry about what the laws are, for people to not have to feel uncomfortable in their own skin, because it's just normal to see people that are different. And that's the beauty of the community, is just being able to, you know, feel like you are part of it. You're not an outsider. You're just who you are, and you don't have to explain who you are to anyone. And I think that that would be the beautiful thing to come. I mean, there's a lot of work in different aspects, but I think from a social perspective, I think it would be that you don't look twice. You don't feel like your people are staring at you. You just get to walk down the street like everybody else. You get to be in a relationship with whoever you want to be with. You get to hold hands with whoever you want to be with. And it's not a political thing. People aren't yelling at you, and there's not that kind of hatred that comes from things that are no one else's business, in my opinion. So that is my hope and vision for the future. And that's how I always want patients to feel when they come see me, is that, like, I just care that you feel supported and that you're safe. And I don't care who you sleep with, or who, you know, your family is, however you want it to look. And I want you to feel like you get to be whoever you want to be here.
I appreciate that. I know we're running up on 5 minutes till here. And so with that, there's a couple questions there, and I'll let you and the panelists pick the ones that you feel comfortable answering. There was a question in regards to, you know, a general practice and not a specialized practice. And there was also a question about Judy Brown who another great friend of mine up in Portland, Oregon, an amazing human being. And so I'll let you figure out what you want to make sure in the next 5 minutes, 4 minutes, that you want to make sure that you tell the people that are attending here that really just resonates with you. And again, whether that be the safety of a provider, of transgender individuals, with the nature of the world that we're currently in. And I'll let you pick. This is panelist pick is what this one is.
I mean, I see this one that says, sometimes I help my colleagues with their patients. These are established in that doctor's general practice. It's not a transgender specialized practice. And I wonder when I walk into a room of a trans patient, if I should ask that person how they want to be identified. It says they don't want to seem presumptuous or insensitive because they don't ask that to cis people. I mean, I like that. What I try to do is normalize things and ask everyone the same thing. So that's often what I try to do. So you're going to already ask someone, what would you like us to call you? Even though you already have their legal name. You're going to ask them what pronouns they are. And you're going to ask them, the sexual questions. You're going to ask these questions of everyone. And then it's not presumptuous because, you're using that across the board.
For me, like I said, whenever I'm meeting a new patient, it's on our intake forms. We've made those changes so that it's already on there that, you should feel to put the name you want to go by, your pronouns, your sex at birth, and then how you identify now. And that just sort of, I think, both gives me the information that I can use to start with, without having to ask them, but also makes them know that we're conscious of it and care about those kinds of things. And then once I meet them, then I just ask them directly, what would you like me to call you? How do you refer to yourself? And those kinds of things. But it's given, the same form is given to every single patient, whether they're cis, trans, male, female, whatever. And so that way it kind of already sets that parameter, and then you can go from there. But I think that that's important too, is just that being part of every patient's medical intake form, in order to make it, I think another way of just normalizing these patients in society is that should just be a standard of care.
I agree to the standard of care piece of that. And Professor, with you, I know we've got about a minute left, and then I'll give a quick ending here. But I would love to hear from you on your thoughts as well. If there's a question that we're missing that you want to address here in the last 60 seconds. And so
I think my colleagues have nailed it.
no,
I've got nothing to add on top of that.
I think so. And I guess the last little piece, number one, thank all of you. I appreciate you for the work you do, your lived experience and learned, and the way you take care of people. And us being forever learners. And so thank you for that. And a reminder that there will be no episode in December, but join us for in January. We'll have a new episodes, great discussion on access to care for patients living with HIV. And on HIV/AIDS, and on January 18th, sign up and watch past recorded episodes at outcarehealth.org/OutTalk, which I think, they're in Dustin, Doc, just like that, did a fantastic job putting a link in there, and we'll get another one in there as well. But I appreciate all of you, and thank you so much, and feel free to connect with our organization. And so thank you so much today.